The main goal for our project was to identify those at risk of representation and readmission to hospital, improve their quality of life, improve their healthcare experience, and more importantly, address not only their medical, but social needs.
This is a new project that we've taken up, which I think has not been implemented in the past. It's a different view, it's a different outlook to a solution. Rather than throw in a lot more funds, it is to use what is existing and to redesign the health system so that it is much more efficient and innovative in a way of delivering health cases.
The Centre for Healthcare Redesign is a virtual centre and we offer training in many forms. So there's the long programs such as the Diploma program, but we also run very short programs. We run 1 week improvement programs, we run programs for simple skills for implementation. We have an e-learning platform that anyone can use, and importantly we have our arms in the district, the redesign leads, who provide that local coaching, support and expertise to staff in the districts who want to make a change.
So the training program has involved us, first of all, putting together a team, and really it was about looking at building our capability for the future. So our key objectives are to ultimately reduce representations to the emergency department and to reduce readmissions to hospital.
Health professionals are very good at what they do in the area of health. They're not that good in talking to their colleagues, their peers, their seniors, in making things happen and making things change. The other thing about health is it's got a long tradition and it's really hard to change some of the things which come down with tradition. What the ACI provides here is a structure and the ability for people to know how they bring about change. Most importantly, perhaps, in the program is that the presenters at the ACI who work with our teams are able to inspire them to greater heights, to working harder and to trying to make that difference.
The training program's fantastic. There's a lot of support with the staff from ACI and you're inspired every step of the way. They lead you through the various stages of our projects, and we also have a clinical lead within the local health districts to go to for help as well. So it's great.
Well, I think the best way that a sponsor can support a team is to give courage to their ideas and to allow them in some ways to come to us if they feel that they need an advocate to talk with others. It was actually a great privilege to be a sponsor of the team and to see how in a short space of time they were able to take imagination and ideas for the welfare of the community we serve and turn them into a reality and to achieve results at the end of it.
Redesign leaders are a fantastic local resource. So they work in the local health districts. They provide staff with support that can look like capability building, negotiating with stakeholders, some project advice, some advice on how to implement, how to just manage some of those obstacles that come up in a project.
I think if we didn't have the redesign lead, we probably still wouldn't be at the stage that we're at. We wouldn't have been implementing at the moment.
One of the keys to successfully implementing a project is to build relationships between different groups and build partnerships. The VIP team, they were running a very complex project. So I worked with them so that they could scope and define what it is they really wanted to do so it was achievable for them.
We're about 3 months into our implementation stage. We've had fantastic engagement across Maitland and Curry in our process, and we've been very lucky to have some fantastic initial outcomes. The ACI process for me has not only given me the skills to move forward with change management in the future, but also really given me relationships that will help me grow and further my career as well. So it's been a really positive experience.
One of the benefits of the redesign methodology is that they can learn the foundational skills and then apply that in their workplace and share it with others that they work with, even in just small changes to fix small problems.
As JMOs, we sort of go through medical school and learn a lot about the diagnostic and management issues for healthcare. But I think getting involved in things like ACI really open your eyes to that sort of systematic approach to healthcare and aspects of public health that you don't really necessarily encounter as a medical student or a JMO.
Today is the 7th Centre for Healthcare Redesign and Graduation Ceremony that I have attended, and I'm thrilled to see so much passion still in this program and in this room. Innovation for me is a very special word in health because it's absolutely essential. It provides us with better care for individuals, it improves the health of the population generally, and it makes the most of our health dollar. I strongly encourage all of you to continue on with the work that you've done in this course. Every improvement that you make makes a difference to people's lives.
Our job at the Clinical Excellence Commission and at the ACI is to identify people who can be great change leaders and to support them in the skills that they need to make that change. There's nothing more important than teaching people how to drive improvement.
Today at graduation, we already saw that some of these projects are having a big impact, and we're actually seeing a better health journey for our patients. And that kind of energy in the room, you can really pick up on it because it's so rewarding when you're able to see that you can really make a difference.